Hi, it's Brad Leach here. I'm a speaker for the upcoming Bioceuticals Clinical Mastery Masterclass held on the 9th of February, where I'll be sharing the latest advancements, protocols, and evidence-based interventions for increased intestinal permeability. So if you'd like some tools to improve your confidence in the management of intestinal permeability in your clinical practice, find out more by visiting bioceuticals.com.au.
This is FX Medicine, bringing you the latest in evidence-based integrative, functional and complementary medicine. I'm Dr. Damien Christoph, a Melbourne-based chiropractor and naturopath. Joining us on the line today is Dr. Jen Keating. Jen Keating is a highly skilled and PhD awarded chiropractor and researcher with a special interest in paediatric care. Her particular focus is the neurological development of the child. Dr. Jen runs educational courses in paediatric neurological development and delivers diplomate-level accredited courses worldwide to help educate practitioners about children and neurological development. Jen has a keen interest in the facilitation of shared care and the advancement of paediatric care to assist in proper neurological advancement of the paediatric patient. It's a real pleasure to have you joining us today, Jen.
Thanks, Damien. Pleasure to be here.
Jen, I'd love to start by asking you some questions, please, about how and why you became so interested in this field. How did you get here?
Oh, a long story. I've been in practice 35 years and really the beginning of it was I had a head injury from diving into a pool when I was 12 and I hit my head on the bottom and suffered a concussion, not that it was diagnosed that way. And really my life, I wasn't well, I had shocking migraines and I got help with a chiropractor. And from that, I got really interested what's going on here. So I worked there part-time as a high school student and then studied chiropractic. But I've always been fascinated about, child development and how do we support healthy development for families and communities. And that's what drives me.
Yeah, I think that's such a common thing within our fields of care, whether it be naturopathy, which, I'm a naturopath and a nutritionist, and then also as a chiropractor, it all came from our own experience, didn't it? A lot of people experienced it because we, for whatever reason, we all kind of were thrusted into a particular model of care as children growing up. And then, as we maybe find a different path or see a different avenue, we can often take that. And I found that too within chiropractic. When I was experienced in chiropractic, I thought, maybe I want to be a chiropractor. But then when you see people like yourself and other, great chiropractors doing great things, I then became interested in doing it. But even from a naturopathic perspective, before I was a chiropractor, looking in at what you were doing and what other chiropractors were doing, I was blown away. So these days we see issues with kids that we've never seen before. We see autism, we see ADD, we're seeing Asperger's, we're seeing all kinds of neurological issues. What do you think's going on at the moment? Why is this happening right now?
Yeah, well, there's been a rapid increase, and some people say is it just down to improved, diagnostic criteria because we need, we know that early intervention for some of these neurodevelopmental or all neurodevelopmental disorders is really important. So there is a push to diagnose earlier, but I just the improvement in diagnosis doesn't cover it, and there's an argument to say is toxicity, and chemical toxicity in our environment has increased, and children are more susceptible because of their rapidly growing brain and nervous system and their immature, detoxification organs, so that they're more susceptible. And there is an argument to say with the change in our food and the change in our environment and, medications, for children have increased. And so there's an argument to say that could be a component of how, development is changing. But the other thing, of course, Damien, that we're seeing is, and particularly, with changes to a lot of online stuff over the last couple of years, we're seeing that real change in posture with children, that head forward posture and that internal rotation in the shoulders and that sort of forward into the thoracic spine. And that's significant for a couple of reasons. It's not only about, posture, but it's about that affects airway. As the head comes forward and the jaw sort sort of comes down, the tongue sits lower in the mouth. We don't get that good lip seal, good muscle use for that breathe, suck, swallow cycle, and that affects oxygenation, as does the lack of rib cage movement as the thoracic spine comes forward and the shoulders, internally rotate. We decrease the ability of the lungs to take a good deep breath in, and that oxygenation is really important, for all of us, but particularly for kids because their brain is, as I said, still developing. So when we get that change in the airway, the change in the posture, the increase in tension in the neck with that head forward posture, that has dramatic impacts on, children's growth and development and their health and their well-being. If we're not breathing well, swallowing well, chewing food well and using all those muscles well, then nutrition and gut are impacted, the nutrition to the system, but also the way the gut functions is impacted because of that sort of mechanical change with what's going on in the airway. We see so many kids that really struggle with textures of foods. They just want those blander foods, but they want that sort of easy to chew texture. And, don't get me started on the squeegee packs that parents squeeze, mashed up food into, pureed food into kids' mouths. We won't go there, but, that whole movement of the mouth and the saliva and the swallowing, they're really important to stimulate all those branchial arch nerves into the brainstem and, for development. I think, kids are really babies, particularly in young children. They're very brainstem and diencephalon sort of driven creatures. We don't have a highly developed upper cortex yet, when we're born, and that happens over those coming years. And I think it's really incredibly important that we get good movement and good extension tone into there to help fire and wire the brain.
This is so great, Jen. I tell you, but I have to tell you, and like so many other people who are into food right now, people are going to go, what do you mean squeegee packs? What's wrong with squeegee packs? So I'm going to take you back there because I know you said I don't want to get into it, but I do want to get into it.
Oh, okay, great. Oh, I'm happy to go there.
Are they really that bad? What's the story there?
Well, I think they are, because texture is really important when, babies move from hopefully breastfeeding or formula feeding. If breastfeeding, let's be open-minded about things people choose. But, we know that there's not enough support for women to breastfeed in a lot of quarters. And, if we can get that breathe, suck, swallow and get feeding happening well, then that's an important early start. But as we move on to, solid foods, the whole thing about child development is, I think of it as scaffolding. They might start on a bit of puree stuff and they might have a bit of experience of sucking on fruit or veggies themselves and getting into that whole experience of it. But over time, we should be able to increase the texture so that they can get those muscles working. The oral, function is really important. And if we're on squeegee, sort of really highly pureed foods all the time, children don't get that sensory experience of their hands and their mouth and the face and the mess, but they're also not getting to use those muscles as they should bit by bit. And the muscles that we use to manage food are the same muscles that we use for talking. So we're seeing lots of speech and language delays. And although that's not my prime area, of course, as a chiropractor, my PhD is in early childhood development. And I'm particularly interested in how do we work in an interdisciplinary, collaborative way, because none of us have all the answers. It takes a team approach, even for typically developing children for healthcare, but particularly for children that have higher needs. So I'm particularly interested in that speech and language development and how do we get that whole breathing, coordination going for language. And that comes from chewing your food as well.
This is so profound that a simple little thing, I'm not going to make this too basic because it's not basic, it's complicated, it's multi-leveled, it's multi-levels of the scaffolding, as you would say, Jen. But it seems that much of the neurological development of the pediatric patient falls apart or falls away in those early months, when people are trying to determine how do I breastfeed, can I breastfeed? Is there a mid-suck? Am I getting, the nipple to the back of the throat? Is the baby gulping air? Is there reflux? Am I using medication? Then we move on to, food at 4 months now. The recommendation for children to be getting solids at 4 months. I don't know where that came from, but
well, the
maybe
World
we could
Health
talk.
Organization still says exclusive breast or formula feeding till 6 months, and that's really reassuring, Damien, for patients to hear, because there is that little bit of a push to go earlier, but the gut's immature.
Yeah.
The system to handle that's immature, and there's really not a need for it. So,
well, yeah, we could go on for years or days at least trying to find out why that is the recommendation. But I do think that there's this speed of things that happens these days, Jen, that there's an urgency about getting things done. Everything's really, really quick. So it's quick, eat your meal, quick, cook it up, quick, we've got to get to here, quick, get this done. Back in my day, Jen, maybe I'm sounding old when I say things like that, but, the most digital thing that we ever had was Donkey Kong Jr. And you'd play that on your little Nintendo. You'd get bored of that because you got sick of jumping over barrels. But these days, people or kids are playing games for a long period of time. I used to read a lot, and I don't recall my neck posture being better or worse than kids that are on games or screens all the time. What's the difference between reading a book and playing a game?
My PhD thesis was nearly going to be on the parental rationale for early screen time in very young children, but I changed that over, and I'll talk about what it was in a minute. But I've been really concerned about the shift that I've seen to children, really young children, 2, 3, 4, 5 months old even, being given, phones and iPads to entertain them. And we could go, so there's the postural component to that, and you see that every day, and we all see that as kids kind of slump right forward. And we talked about that increase in tension in the neck and the difficulty with the breathing. But the other component of that is the eye movements that we use when we're looking at a small screen. So if we think about, when we're changing focal distance in a normal sort of environment, and we're, maybe looking at a book, we might, change that focal distance. But what happens when we're looking at a small screen, and I'm not talking so much about TV, but I'm talking about sort of screens closer than that, we use saccadic eye movements. Saccade movements of the eyes are those short, sharp movements, and they're driven by an area in the prefrontal cortex. We're going to the area. They're a frontal-driven eye movement, and they're short and sharp movements. And there's some really interesting research coming out about that hyperplasticity of the frontal-driven saccadic movements as compared to the slower pursuit movements, which come from the parietal area, and they drive those slower, longer movements of the eyes. So I think there's something interesting that happens in that screen refresh rate with games, and all kids TV now. They looked at early TV for kids, and that was shot in one long scene. There wasn't that rapid screen refresh changing rate. And so there is some arguments about, are we training short attention spans and a lot of stimulation needed to hold attention? And that does worry me with what I'm, seeing with kids today as well. So I think there's that sort of product of the visual type of activity that we're doing when we're on screens a lot. But there's also that whole thing of self-regulation. We used to talk about executive function with kids or adults as well, a bit like air traffic control, holding ideas and what's incoming and where do I put that piece of information and how do I plan for something and how do I pay attention. They're all the sort of prefrontal cortex executive functions, but really now we think of it as self-regulation. How do I stay calm and present and be able to, soothe and settle myself so that I can pay attention to what I need to pay attention to, or think through an idea, or plan an activity, or hold a goal in mind. And of course, when we think of self-regulation, there's all the things that get in the way of that. Things like from the biological domain of, uncomfortability in the body, muscle tension, inability to kind of sit still. And then there's, oversensory stimulation for sights and sounds. And all of that richness of sensory information, there's all of the emotional feelings when children are upset about something, if they're hungry, if they're feeling uncomfortable, if their guts, sending that sort of interoceptive, discomfort. That's all about barrage of sensory information that comes into the thalamus and up into the cortex, and it's got to be dealt with, by the brain and, choose what we pay attention to. And you can picture that 5-year-old, sitting on the mat in class, and there's all of the kind of kid next to him wriggling, and somebody's rattling paper, and the boy's hungry, and the teacher's coming in, and there's a lot of, there's a lot going on, all the stuff flapping around in the classroom. And that's a lot for a child to try and contain and concentrate on instructions from the teacher and just learn and put their ideas together. And because that brain is immature, young children don't have good self-regulatory capacity. It's really about co-regulation. When we're born, our cortex, as I said, is so immature that we need a significant caregiver to help us calm and regulate and feed and warm and comfort. And over time, that transitions over into children being able to take more of those, care activities on themselves. And there is an argument to say that the better that the mother or caregiver provides that co-regulation, the better the child can learn to do it themselves. Mm-hmm. And so I think we're seeing, an epidemic of dysregulated children, that don't have that ability to kind of settle and calm and soothe themselves. And I think, screen time is used, to come back to the screen time part of it, screen time is used to calm a child, but it actually doesn't calm a child. It quietens a child for now. It occupies them. And there's all that sort of overstimulation of the dopamine reward pathways. Kids get quite addicted, if I can use that terminology, to their games or, to what they want to play, and the tantrums and frustration that comes from that I see every day in practice in different ways. And I think as society, as parents, as, therapists, as practitioners, it is our job to support families to how to help their children in their regulation capacities, their self-regulatory capacities, and build it for them over time.
This is so good, Jen, and I'm glad you brought up that the bit about the addiction component, and it's fair to use that because we'll be interviewing Dr. Wayne Warburton. I'm not sure if you've met Wayne before.
I know Wayne well. Yeah. I had him speak at one of our conferences a few years ago. His work is quite outstanding, and I've shared that with a lot of our families in our practice, and it really does help them to understand what's going on there. Wayne's fabulous. Yeah,
he is fantastic. I interviewed him on the Wellness Guys many years ago, and I saw him in New Zealand at the NZCC event that they were holding, and the research he presented was just mind-blowing, and I can't wait to share that with everybody listening to this. But I think it is really important, and to think about the ways in which we used to self-regulate. It would be, if I was roughing up my brother, or I was just getting a little bit besnickety or narky, Mum would say, go outside, throw the ball at a cricket stump, or go climb a tree, or, teaching me other activities that are outside of blue light stimulation, because we didn't really you didn't really watch television back then, and you weren't looking at screens because there's no mobile phones, and there's only so long you can look at a phone with a dial on it, isn't there? A round dial, you can only play patterns, So being able to go outside or ride your bike by yourself, not having to have a conversation with other people. Kids these days feel like they've got to be surrounded by people. So giving people that time, giving kids time to just down tools, I think is a really important thing. What else could they be doing?
Well, I think, that movement thing and that outside, we know the calming, the Japanese have the whole thing of forest bathing, and we know that outside activities, are really important for kids to just get their body moving. I often think about, we spend a lot of time in flexed forward postures, whether we're on screens, whether it's schoolwork. I see, as you know, Dame, I work with, babies, right from, I have a lot of referrals from maternal and child health nurses and paediatricians and GPs, for babies with, say, asymmetrical patterns or tension in their system or inability to turn their head, one way. And they're really important, because if we don't have that symmetry in the system, and maybe it comes from the way we give birth these days and the move towards sort of medical intervention in birth. And there's a time and a place for that, but where the percentages of, epidurals and Caesars are way higher than, what would be sort of normally expected in our society. But when we have children that have difficulty with, extension tone, even that baby lying on their tummy and lifting their head up, because we put babies on their back to sleep since the 1992 American Pediatric Association Back to Sleep campaign, babies sleep on their back, and a lot of babies don't like tummy time, and parents get nervous of tummy time with young babies. But it's critically important that babies get lots of episodes. It doesn't have to be long time, lots of episodes of tummy time to start to lift that head and get that extension tone through the neck. That's what fires midline cerebellar pathways, and that's what starts to develop that postural tone that comes in over those next months and months as the baby learns to crawl and sit up and then to walk. And so that extension tone is really important right from very young babies. But kids as well, 2-year-olds, 4-year-olds, 6-year-olds, 10-year-olds, that whole, how do we train that extension tone? And we do a lot of Superman activities over an exercise ball or aeroplane activities, or, even just as they get older, exercises where they get their shoulders back and lift their chest up. So we can really work on that extension tone, partly to counteract, just the physical counteraction of the flexion that we all kind of sit in. And this applies to adults as well, of course, but also to really stimulate those brain pathways. That movement into extension is such an important thing for kids and adults as well, as I said. And then other things like concentrating on breathing. Kids do a lot of shallow breathing and mouth breathing, but to really help children with nose breathing and rib cage movement and getting that diaphragm moving, that has really powerful regulatory impact on the nervous system, because of that, the breath in to breath out, the sympathetic to parasympathetic tone, and also that physical stimulation of the gut, for the diaphragm to move down and really work those abdominal organs. That really helps with digestion and firing of, parasympathetic tone for rest, digest, and, rebuild and recover. So extension tone is really critical in any sort of way, and that can be done really simply right from birth. But then, as I said, breathing, and of course, nutrition, as we talked a little bit about the kind of texture and the structure of food and chewing, but of course what the nutritional capacity of our food is. As you said, that fastness, quick meals, hurry up, that's that chewing and that enjoying of food and the social aspect of food that brings that calming to be able to digest our food. We see a lot of kids that don't sleep well. They don't get to bed early enough. They miss their tired point. Then they're firing their sympathetic nervous system again. And kids say, I'm not tired. I lie awake. I need to stay up later. No, they actually need to go to bed earlier to catch that tired point. We've got that whole families and whole communities of push, drive, and stress. Parents really kind of getting frustrated and stressed with kids and coming down really hard on kids, and then kids not feeling calm and safe and comfortable, so then they can't relax as well. We don't digest our food as well. We don't sleep, and that's how we're breeding an epidemic of, developmental challenges and ill health in people. And, I don't think it's rocket science if we can all work together, different practitioners all work together to be able to support healthy, development in children. And, of course, gut function's a really important part of that. It's all very well to, think, if we think of the vagal, concomitants from the brainstem affecting the vagus, Stephen Porges' work about the myelinated vagus and the, how that helps calm and regulate. It's really important information for us to understand to support children. It's no point trying to intervene when we have, say, depressed teenagers. We've seen, an epidemic of stress in teenagers and, mental health challenges. And, it's not that it's not important to intervene, then it is, but we can set up a robustness earlier as a society if we do work together to help, prevent a lot of it and help support a lot of the development that encourages children to know how to calm and settle and soothe themselves. And I think it's critical. I think we could be all doing a better job for that for our kids. Kids are born so, developmentally early than any other mammal. Our brain it undergoes secondary altriciality after we're born, that secondary, growth. And it means that we have a wonderful opportunity to get things right. And it's not about perfect. There's also a lot of parents that really are trying to get it perfect, and in trying to do that, they're putting themselves under so much stress, and they've made child rearing a higher cortical event rather than a right brain connecting to your feelings, emotional connection. And so that sort of right brain to right brain of the parent to the child to be present is a really important part of development. And because there's all these apps and rules about how you raise a child, it's really become an intellectual event, and I think that does get in the way of
it's become a little bit too cerebral. Yeah, too cerebral, too many spreadsheets.
Right. Yeah, that's right.
There's a couple of things that you mentioned earlier on. One was back to sleep. And we're going back to that 1992 piece in America, which we tend to adopt everything the Americans say, and then we go, oh my gosh, we're becoming more like America every day. That's because we do what Americans do. So not that that's a bad thing, and that can lead research and understanding and inquiry, but the back to sleep thing, though it's, obviously was done for a particular reason. When I put my head backwards, Jen, and tell me if it's just me, when I put my head backwards, my mouth automatically opens, and it feels to me like it's easier to breathe through my mouth. And I wonder whether or not there's something there that, because children are spending so much time on their back, even when they're asleep or when they're awake, it draws the mouth open so that they become mouth breathers. And I wonder whether or not that's got something to do with tongue position and then breathing, and how that might affect neurodevelopment, the lack of extensor tone, which you talk about, obviously affecting posture, the inability to go outside and hang out, or to, perform tasks that would engage proper movement of the body and coordination and catching a ball and kicking a ball and all of those sorts of things. Is this affecting neurodevelopment in children? Is this what we're saying? All of these things together?
Yeah, I think it is. I think it is, Damien. I'm not sure that a child sleeping on their back, I'm not sure that drives the mouth open. I know it does, in adults if you put it into extension, but with kids, I'm not sure. But what I will tell you is, the back to sleep, we've seen such an increase in plagioccephaly with children, that flat on one side of the head, because oftentimes children from birth, they can have an asymmetry due to the torque and the twist and the way they're born, particularly forceps and von Tuss extraction, but even in, normal birth and Caesar birth as well. Because I see a lot of newborn babies, and of course I want to let you know, Damien, you know this, but I want to let people know, I don't do spinal manipulation, like a high velocity adjustment in young babies. There's many ways that chiropractors and osteopaths work with young babies that don't involve what people might be thinking of as that rack and crunch or whatever people want to call it. It's a very finessed unwinding of tension. Babies aren't little segmental kind of units. They're a whole body posture that we unwind. But so if children have an asymmetry, a head turning preference or a torque in their system, and then they sleep on their back, because all back sleepers don't get flat heads and plagioccephaly.
That's true.
Babies that are susceptible do, because heads are soft and they're heavy and they lie in that one position. That's how they get a flat head. And there's an association, not causation necessarily, but an association between the flat head, the plagioccephaly, and an increase in ear infections. A change in muscle development, delayed motor development, and also delayed cognitive development. And this research, Miller and Claren did this research back in 2010, and Speltz and Collette have done time 1, 2, 3 from 6 months, 12 months, 18 months, up to 3 years studies on tracking children that have plagioccephaly and what happens with their development. And there is an association with delayed motor development, delayed meeting of motor milestones, and also cognitive challenges, increase in ear infections, as I said, changes in peripheral visual field. So plagioccephaly is not just an aesthetic issue, and that's a big issue from the Back to Sleep campaign. And I'm not saying children shouldn't sleep on their back. Of course, it's the advice and I recommend it as well. But what we need to do is deal with the children that have the underlying asymmetries that cause the plagioccephaly. And also really, if we just had a public health campaign around back to sleep and tummy to play, which they tried to do, but it didn't go well. But those tummy time episodes, and really help parents understand that babies lifting their head helps their development and it helps their motor development and their cognitive development. I don't find parents that have trouble doing that once they understand why. We're all better at doing something if we know what's it for and what's the value in it and how does it tie in with things that matter to us. So, but I think there is a big change in development because of all the reasons: nutrition, the way we birth our children, the emotional stress, the lack of co-regulatory capacities, and all of those things that happen. And if we think, Damien, evidence-based practice, people think about that as research evidence. Yes, it is. That's one component.
Love to talk about this. Yeah.
But there's clinical experience is critically important, and there's patient preferences and values, and that matters in evidence-based practice. It's a triad: best available research evidence, clinical experience, patient preferences and values. And I think person-centred care is critically important. And when you're ready, I'd love to just talk about the government survey that was done, if that's okay.
Yeah, I'd like to talk about that, Jen. I think that's really important. There was an issue a couple of years ago that it was on YouTube, then it made it to television, and then subsequently people became nervous of chiropractic. Well, there was a perception that people became nervous of chiropractic for children. And so this perception that chiropractic may be unsafe for children kind of gained a little bit of traction, but you're at the coalface of that. You're at the forefront, and you worked with government in helping them understand how chiropractic can be used in an integrative fashion, integrative model of healthcare using evidence-based practice. And so I'd love you to just share a little bit of light on what you discovered, because I think it's important for the practitioners listening to this right now to understand that what the media say may not actually be the truth. May not.
Yeah, look, there was a really big push for the then Health Minister in Victoria, Jenny Mikakos. There was a really big push for some ultra-conservative small lobby groups that pushed, to sort of sell that story that chiropractic was unsafe. And none of the research evidence supports that, not only in research evidence, in insurance claims, in reports to AHPRA. There's no evidence to support that idea of lack of safety. So leave that part off the table. And I think then the story was, there's been no issues and there's no, problem as far as safety goes, but it could be unsafe in certain circumstances, and there isn't enough robust evidence at a highest level to support chiropractic care. And that's true. The evidence base is developing, and because there could be a risk, even though there hasn't been, therefore it shouldn't be done. But what's interesting is, Venus published a paper in 2020 looking at evidence-based practice across healthcare. And one of the highest evidence-based practice is, care in cardiology. And the highest grade 1 level of evidence for that is only around 60%. And for things like, dementia care and all sorts of other care, there's clinical, evidence, and there's clinical practice guidelines, and there's lower level evidence. But in terms of that grade 1 evidence, it's not there in a lot of areas, not only in, the work that chiropractors and osteopaths do. But these are very hard things. It's hard to do a randomized controlled trial and do sham therapy and exclude parents from it when it comes to children. There's all the ethical issues of that. So what I want to come back to with regard to that is the government decided, it was run by Safer Care Victoria. They decided to do a survey of the public. It was open for a month. It was hosted through engage.vic, a government website, and it was all anonymous and de-identified. It was on the government site, and parents could put in, or children, if they were older, could put in their experience of chiropractic care. So there was a stream for those who had accessed chiropractic care for children under 12 in the last 10 years, and there's a stream for those that had an opinion about chiropractic care but hadn't accessed it for a child under 12.
Yeah.
in the last 10 years. And in the parent part of that, there was 22 and something thousand responses, and the other part had 4,500. So 26,500 responses in a month is a huge number of responses. And
it would have almost broken the internet. Crashed the internet.
Well, they had to get external companies in to analyse the data, I'll tell you that part.
Right.
But 26,500 responses. It's the largest healthcare survey done as a one-off survey. The NHS in the UK have slightly larger numbers, but theirs has been running 10 years. So it is the largest, health provision survey that there is. And what I'll tell you from that is, I got access to the data and I wrote it up for my thesis. My PhD, as I said, was early childhood development. It was through coursework and thesis. And my thesis, I got the data. So a couple of things we know. 75% of children that come to chiropractors are under care of another health practitioner, and some up to 7 other health practitioners for that same issue.
Wow.
48% of kids come to chiropractors. This is children under 12. 48% come for musculoskeletal issues, and 40% come for developmental concerns, whether that's, postural concerns, walking, crawling, speech and language. We don't treat conditions as chiropractors, as you know, Damien, but we do work with the posture and the neurological integration to help improve body to brain, back to body, nerve pathways and control. And so a couple of the other things that came out, 99.16% of parents were satisfied or very satisfied, and the large majority of those were very satisfied. So 99.16% with their involvement in decisions about care. 98.35% of parents said that their child improved after the care was provided. And when I summed across the fields of, did you feel involved in the decision making? Was there appropriate consent to care given? Did your child improve? And I summed across all of those questions. 99.6% of parents said their child benefited from chiropractic care. They're outstanding results. They're way higher than even I would have thought they would have been.
Yeah,
it was well represented right across Australia. Each state, that was well represented. So I just think they're outstanding results, and I think it is important parents, want access to healthcare other than what they might consider as standard medical care. And it's not only our care, it's all sorts of care, as we know. And I think as long as there's robust consent to care, that there's not, harm or risk involved, then I think parents should have the right to access the care. And their experience is it makes a difference.
Yeah. Oh, that's profound. Those numbers are mind-blowing, Jen.
They're mind-blowing.
Yeah, it brings me back to the whole, the chat about shared care. I think this is really important. And a great thing for everybody listening to this podcast is to understand that all practitioners can be involved in the care of a patient, and in particular a pediatric patient. Those numbers there talking about up to 7 other practitioners involved in the care of a patient. You spoke earlier about needing a village to help raise a child. In particular, it becomes more important to have extra minds working with children that have experienced a deficiency of their neurological development. It's going to require more things. So you will need a speecher, you might need an OT, you're going to need a chiro, you'll need an integrative nutritionist, you'll need an integrative GP. There's a whole lot of things that you're going to need to help this child catch up and to get back on track. So to hear that data should give a lot of people some confidence that chiropractic can be part of, as well as other therapies, osteopathy, physiotherapy. These are all movement-based practices. We can all be involved in the care of the pediatric patient. I think that's really, really important. That's so good, Jen.
Critically important. Yeah, critically important. Dame, my area isn't nutrition. I've got a very basic understanding and I'm interested in it, but I'm not I'm not the person with the skill set. I have fabulous people that I work with and refer to and, who refer to me as well. And I think that's it. It does take a multi-pronged approach. And if we sit there thinking we've got answers or the answers, I think we're doing a disservice to our kids. We do need to work together, but we need to understand what each other does as well, so we know how to into refer and how to, to look after people. I just want to see more healthy, vibrant communities, and I think, our profession plays a role in that, as many others do, and, it's for the good of the outcome for the kids and the families.
Yeah, good on you, Jen. Jen, it's been absolutely incredible to have you on the podcast with me today, and I'm sure that the thousands of subscribers to FX Medicine will absolutely love this discussion and get a real sense of the importance of shared care for the paediatric patient. And I'm so grateful that you've given me freely your time today to help people understand more about paediatric neurodevelopment. Jen, where can people find more about you and your work?
I practice in East Hawthorn. We have a really busy and vibrant practice there, and as you know, I teach to chiropractors and some continuing professional development work, and I teach a 2-year postgraduate, program to chiropractors as well. But also I speak for, the dentists and the midwives and the lactation consultants. They speak at my, seminars. I speak at theirs. I'm in close contact with a lot of integrated GPs and naturopaths. But, that's my work. I'm working on writing a book at the moment, because I think it is, and that's really actually more for families, but what are the sort of building blocks of healthy development, and how do we, turn the health of our communities around into a more positive direction.
Oh, that's the greatest. I'll be stocking that book in my practice, there's no doubt about it. So if you want to find out more about Jen, go to www.dynamicneuro.com or inspiralresources.com. So you can go there and check her out.
Thanks, Dane.
But thanks everybody for listening today, and don't forget that you can find all of the show notes, transcripts and other resources on the FX Medicine website. I'm Dr. Damien Christoph. Thanks for joining us.
This podcast is intended as healthcare practitioner education only, and it is not a substitute for medical advice, diagnosis, or treatment.